Hi, Mike Gibson, Samit Shah, and Samit, share with us some new insights into ischemia with non-obstructive coronary artery disease.
Thanks for having me, Mike. So, ischemia with non-obstructive coronary arteries, or Inoca, has been recognized for a number of years, and you've been part of the kind of foundational work in this field. But basically, these are patients who have ongoing symptoms of chest pain, shortness of breath, and other anginal syndromes. But when we take them to the cath lab and look at their coronary arteries, we find no obstructive disease. And this
Just another false positive.
That's right, exactly.
Yeah.
And because of that, it's been a thorn in our sides because we don't know what to tell the patients. And these are some of our most symptomatic patients with very high healthcare utilization.
Yeah, there's a lot of underlying reasons why someone has chest pain without having obstructive epicardial disease. And I think we've done our patients, particularly women, a disservice by saying nothing to see here. So what did you find?
So in Discover Inoca, it's an investigator-initiated study where at 9 centers in the United States, we enrolled patients who came to the cath lab with suspected ischemic heart disease. If they were found to have non-obstructive disease, they then underwent a protocol-guided coronary function testing protocol. So that included coronary angiography to look for obstructive epicardial disease, physiology with the CoraFlow system to look at their epicardial physiology, as well as their coronary flow reserve and index of microcirculatory resistance, acetylcholine testing, and then intravascular imaging in every patient. And Discover Inoca is one of the only studies that mandated intravascular imaging with coronary function testing.
And what did you find?
So interestingly, we found that this is a highly symptomatic patient population. So, like you said, predominantly women. Of our enrolled patients, 78% were women, and that's a very high number for a cath lab-based study. This average Seattle Angina questionnaire summary score was 53.5. And just to put that in context, the ischemia trial SAQ summary scores were around 80. And so a lower score is worse. And these are some of the most symptomatic patients that we saw. And then 94% of them, when they came to the cath lab and we did this structured coronary function testing protocol, had a vasomotor diagnosis. It's
Wow.
surprising to a lot of people that vasospastic angina was the most common, so
Hmm.
36% of patients.
Really, I'm kind of surprised by that. Wow.
That's right. Well, so there is a high prevalence of microvascular disease as well, but isolated microvascular disease was only 17%.
Hmm.
What you see is a mixed picture with both vasospasm and microvascular disease in almost 30% of patients. And this shows the value of coronary function testing, that it's hard to assume the diagnosis or to use non-invasive tests where we don't do the vasoreactivity testing. It's really key to get that full picture because patients may have confusing symptoms, both exertional symptoms from microvascular disease and then resting symptoms from vasospasm.
Well, it's sad people aren't being more aggressive with testing for vasomotor function. I hope this study and others will kind of change that perception. We need to be looking more frequently at this in the cath lab, don't you think?
Absolutely. And Discover and Oka showed that we can do this in a standardized way across sites, and it's safe. 99% of patients completed the procedure without any safety events, and it has a very high diagnostic yield. So we hope that Discover and Oka will change that going forward, and our patients, especially women who come to the cath lab, will finally get answers.
Thanks for sharing, Samit. Let me know anything I can do to help you guys get the word out, or guys and girls and women. Big problem. Thanks for sharing with us.
All right. Thanks for having me, Mike.